Your feet take a beating. You've been on your feet all day and now they're aching, sore, and just plain tired. But you keep pushing through because that's what we do, right? We power on and figure our feet will bounce back. But what if they don't? What if all that wear and tear starts causing real problems? Don't take your feet for granted. Getting them checked out by a professional can make a big difference down the road. At our clinics, we take foot care seriously with state-of-the-art treatment personalized just for you. We'll listen compassionately and develop a care plan tailored to your unique needs, so your feet can carry you comfortably wherever you want to go. Don't settle for aches and pains. Your feet deserve better and we're here to provide it. Warning signs: your feet need attention. Unfortunately, most people spend long hours on their feet, walking, standing or exercising, which can lead to pain, injuries, and other foot problems. Spending all day on your feet puts excess stress on your arches, heels, and ankles. Over time, this can cause inflammation and tears in tendons or ligaments. You may develop plantar fasciitis, a painful condition caused by overuse that feels like a stabbing pain in the bottom of your foot. Bunions, corns, and calluses are also common afflictions for those constantly on their feet. Not giving your feet a break can make existing conditions worse and speed the onset of joint and bone problems like arthritis. Your knees, hips and back may start to ache from poor foot support and alignment. It's a domino effect that impacts your whole body. Seeing an advanced foot nurse for regular foot care helps detect problems early and prevents long-term damage. They can evaluate your gait, arches, and pressure points to determine the proper orthotics or shoes for your needs. Your whole body will thank you for it. Keep walking, keep moving, but do it comfortably with healthy, happy feet. The dangers of neglecting foot problems: pain, swelling or numbness. If your feet frequently hurt, swell, or feel numb, it's time to see a foot care nurse. Conditions like plantar fasciitis, arthritis, or nerve damage can often be managed if caught early. Don't ignore foot pain. It's not normal and usually means there's an underlying issue that needs treatment. Have your feet become misshapen or harder to move in certain ways? Conditions like bunions, hammer toes, or drop foot can often be prevented or minimized if treated by a foot care professional during early stages. Wounds or injuries that aren't healing. Any cut, sore, blister or other foot wound that isn't starting to heal within a week warrants medical attention. See a foot care nurse right away for proper diagnosis and treatment. Difficulty walking or balancing. If walking, standing or balancing has become challenging, it's important to determine the cause. Muscle weakness, joint damage or other age-related changes can often be improved with appropriate therapy and orthotics provided by a foot care nurse. Your feet do so much for you every day. Early diagnosis and treatment of foot conditions is key to pain relief, mobility, and an active lifestyle. Put your best foot forward and call for an appointment today. Many people dismiss foot pain or discomfort, hoping it will just go away. But ignoring foot problems can have serious consequences. Minor issues like corns, calluses, ingrown nails, and bunions often develop gradually. As they get worse, they can become painful, limit mobility, and require medical treatment to correct. Seeking early diagnosis and care from an advanced foot nurse can help prevent small problems from becoming serious conditions that negatively impact your health and quality of life. When left untreated, foot conditions provide the perfect environment for bacteria and fungi to grow. An infected corn or ingrown nail, for example, needs prompt medical attention to avoid complications like cellulitis or osteomyelitis. Diabetics especially need to monitor their feet daily and get professional foot care regularly to minimize the risk of dangerous infections. Conditions like flat feet, heel spurs, and arthritis can slowly alter the structure and alignment of your feet, ankles, and lower legs. Custom orthotics, physical therapy, medication, or in severe cases, surgery may be required to relieve pain, improve mobility and slow the progression of joint damage. The sooner you address any structural foot problems, the less invasive the treatment needed. Rather than taking your feet for granted, give them the care and attention they deserve. Seeking professional diagnosis and treatment for any foot pain or changes in your feet's appearance or functionality can help stop minor issues from becoming major problems. Your advanced foot nurse can develop a customized treatment plan to keep your feet, and the rest of you, happy and healthy for the long road ahead.
What to expect during your appointment?
Expertise. Professional foot care nurses have years of training and experience treating a wide range of foot conditions and injuries. They stay up to date with the latest techniques and technologies to provide the best care. If you're dealing with foot pain, a strange growth or rash, or other issues, a nurse can properly assess the situation and determine the underlying cause.
They can then recommend an effective treatment plan tailored to your needs. Preventative care.
Seeing a foot care nurse regularly for checkups and screenings is key to maintaining foot health and preventing problems. A nurse will examine your feet for any abnormalities and check for risk factors like loss of sensation or poor circulation. They can advise you on proper foot care for your needs and lifestyle, such as recommending supportive footwear or orthotics.
Preventative care now means avoiding or minimizing issues down the road. Comprehensive treatment.
Foot care nurses provide comprehensive treatment for your feet and lower legs.
This includes services such as nail trimming, callus removal, wound care, and treatment of infections.
They may also perform more specialized procedures like ingrown toenail surgery or injections.
Whatever the issue, foot care nurses have the proper training and equipment to treat it.
They take the time to understand your concerns and medical history, then develop an appropriate care plan to meet all your foot care needs. Seeing a professional foot care nurse is one of the kindest things you can do for your feet.
With their expertise and comprehensive services, your feet will receive the best care possible. Make an appointment today, your feet will thank you for it.